We met Riley when she was 2. She came to us when we lived in Indiana as a foster child. She had a tumor that wrapped around her leg and her lymph nodes and needed to be placed with somebody that could help get her through her treatment.
So when Riley was first diagnosed, she was living in Indiana at the time, and she was about 22 months of age and developed rhabdomyosarcoma, which is a soft tissue tumor. It arose in her leg. My understanding is that she came through the foster care system to live with her family here. Riley was apparently complaining of some leg pain when she first arrived here in California, and so she had some imaging studies done that showed a mass in the area where her cancer had previously been. That arose some suspicions about whether she had a recurrence of her cancer.
It was a shock. We were thinking we were going to go in there and they were going to say, the abnormalities that they saw was just where they removed the other tumor. I did not think that they were going to be telling me that she had a secondary cancer.
There's no question that having a supportive family when you're going through something like this is critical. We put Riley through an incredible array of different treatments, and that's really hard, especially for a small child.
Riley's treatment plan was that she would get chemotherapy first for about 3 months, after which time we would do a surgery to remove the tumor, and then she would resume with chemotherapy. So we really need a team, and one of the reasons I enjoy working here so much is I think we have a great sarcoma team. Dr. Spunt's our medical oncologist, myself as a surgeon, Dr. Kosa is our plastic surgeon who helped take care of Riley, as well as our radiation team, pathology team.
In knowing that this was a large tumor, we knew that there was going to be a lot of tissue that was going to be removed, and there was going to be a large hole essentially to fill in the inner thigh. So my role was to come up with a reconstructive plan that would essentially fill that hole. And everything went extremely smooth with the surgery. So we then moved on to the post-operative recovery phase, and that was a lengthy recovery, which was expected.
Just staying comfortable. There was a lot of times we were in isolation and she wasn't allowed out of her room. We happened to hear somebody singing and came knocking on the door and said, "Can we help you out?" And that was it. Her and Rebecca became best friends. She looked for Rebecca every time we were there. She calmed her down. They would make up songs together about animals or whatever was on their mind. The connection was there instantly for them.
So when I saw Riley, we always have to figure with our complex kids where the orthopedic treatment fits within their overall care plan. So what had happened with her original cancer was that it had weakened the bone and the ball had slipped. And so what we did is we put a screw across the area where it was slipping in the growth center. We hoped it would just at least stop it from moving further, but she has done extremely well. She feels comfortable, she's walking around, she still has her limp, but the pain's gone away. She was the perfect example of resiliency of the kid. Considering having cancer and having it treated and then having it again, she lets you know it's going to be okay. She lets me know it's going to be okay.
I want Riley to grow up and be an adult, and for the memories of cancer to be all in her past and behind her. I want her to be able to do all the things that any kid wants to do when they grow up. She was really a rock star.
I want to be a rock star because I'm really good at singing. And I like rock and roll music.
We brought Riley to us in November, and our intention was to adopt her. Everything really got put on hold because of her diagnosis of the new cancer. We got her through all of her treatment and surgeries, and were able to adopt her in February of this year.